Okay. So, have you ever played that game? Like that
Uh-huh.
game where you whisper a phrase around a circle, and by the time it gets back to you, it's like
Yeah,
completely different.
totally.
Yeah. And it's hilarious.
Right.
Well, in emergency medicine, that's like the opposite of what you want. You
Yeah.
need clarity.
You need precision.
That's where medical terminology comes in.
Absolutely.
You've sent us some fascinating stuff on EMT training.
It's a fascinating
So
area.
we're diving deep into that language
Yeah.
that keeps things clear when it matters most.
When it really, really matters.
Yeah.
It's like a whole new language.
Right.
It's like learning a new language.
It's like secret code almost.
It is a secret code.
Yeah.
A secret code to understanding the body.
And for someone in emergency medical services,
Right.
that code can be the difference between
Oh, absolutely.
a life saved.
Life or death.
Yeah, a disaster averted.
Yeah, get to a scene and you need to be able to communicate what's going on.
Convey that information quickly and clearly
Precisely.
to everyone involved.
To the paramedics,
Yeah.
to the doctors at the hospital,
To other EMTs.
to nurses.
Everyone's got to be on the same page.
Absolutely.
And it's not just about spoken communication either, right?
That's not, no.
It's about documentation.
Documentations is vital.
Using those precise terms.
Yes.
So everyone down the line understands what's going on.
It's about painting that clear picture.
Yeah.
For continuity of care.
So it's like the bedrock of communication in emergency medicine.
I think that's a great way to put it.
So how do we decode this language?
Well,
Where do we even begin?
it's like building with Legos.
Okay.
You have these basic building blocks,
Yeah.
and when you put them together in different combinations, you
Yeah.
get all these different meanings.
So each term has these key pieces.
Right.
The word root,
Yes.
the prefix,
Uh-huh.
the suffix,
Uh-huh.
and
It
sometimes
chimes.
a combining vowel.
Yes.
Okay, so
So the word root.
what's the word root?
Think of it like the foundation of the term,
Okay.
often referring to a body part and, again, a system.
So like cardio.
Cardio heart. And you see that pop up in a lot of different medical terms.
Okay, and then we take
So then you've got
prefixes.
prefixes.
Those are like
little modifiers.
Yeah, they add a
A
little.
little nuance.
Okay.
So for example, you have the prefix ready,
Brady.
which means slow.
Okay.
And if you add that to cardia,
Right.
you get
Bradycardia,
bradycardia,
which means
slow heart rate.
slow heart rate.
Exactly.
Wow. So just that tiny little prefix completely changes
Changes the whole,
the whole meaning of the word.
like those before and after photos, but with words.
Exactly. Yeah.
What about suffixes?
Suffixes often tell us about
Okay.
the condition,
Okay.
the procedure,
Yeah.
or the disease.
Okay.
So for example, you have itis,
Eitis.
which signifies inflammation. Inflammation.
So if you take gastro, meaning stomach,
Okay.
add aitis to it, you've got
Gastritis,
gastritis.
inflammation of the stomach, ouch. I'm starting to see how this works.
It's like a puzzle.
It is.
You just got to figure out,
Put the pieces together.
put the pieces together.
Okay, you mentioned a combining vowel.
Right.
What's that all about?
It's like a linguistic bridge.
A linguistic
Yeah.
bridge.
It smooths out the pronunciation when
Okay.
you're connecting a word root to a suffix. Or
Okay.
to another word root.
Right.
And usually it's an O.
An O.
Right.
Not always.
So it's less about the meaning
Yeah.
and more about just making the word
Making it pronounceable.
roll off the tongue.
Yeah.
Like adding a splash of olive oil to help those flavors blend. And speaking of things that can be a mouthful, how do we make these medical terms plural?
Oh, that's a great question.
Is it as simple as adding an S at the end?
If only it were that easy.
No. Remember those Latin and Greek roots we talked about?
Right.
They love to,
They like to be complicated.
they like to throw in a curveball.
Right.
So for example, you have vertebra,
Vertebrae.
which is the singular for
Right.
those bones in your spine,
Right.
becomes vertebra
Vertebrae.
in the plural.
So instead of one vertebra, you have multiple vertebrae.
Exactly.
Like a whole new level of spelling bee.
It really is.
Okay, so vertebrae.
And it doesn't stop there.
Oh, no.
Diagnosis
Right.
becomes
Diagnoses.
Diagnosis.
Is in the plural.
It can be a bit tricky, but like anything else, with practice, these patterns become second nature.
Exactly.
I'm starting to feel like I need a cheat sheet.
You know,
Yeah.
it can feel overwhelming at first, but
Right.
the more you use them, the more comfortable you become.
The more natural it becomes.
Exactly.
Okay, let's move on to those prefixes
Okay.
that act as indicators for numbers,
Right.
colors. Uh-huh.
And even positions or directions,
Yeah.
they seem a bit less intimidating
They are a bit more familiar.
because we actually use them
We do.
in everyday language too,
Or
right?
all the time.
So like unicycle,
Unicycle.
that's unis
No.
meaning one, or
Yeah.
submarine,
Right.
sub meaning
Under.
under.
Exactly.
Yeah.
So these prefixes,
They transcend
univocal,
jargon.
so bilateral,
Bilateral.
meaning both sides.
Both sides.
Like if you have bilateral knee pain,
Right.
it's the same bi as in bicycle.
Exactly.
That makes it easier to remember.
It does.
Okay, what about those color prefixes?
Oh, those are fun.
Those are interesting.
So you see a patient
Yeah.
and they have a bluish skin tone.
Right.
That's a possible sign of low oxygen,
Right.
and we call that cyanosis.
Cyanosis.
So cyan meaning blue,
Cyan meaning blue.
and then oosis,
Oosis.
indicating a condition.
Okay.
So you've got
Got it.
cyanosis.
You've got it. Then you have leuco
Okay.
for white.
White.
Big leukocytes.
Leukocytes.
Those are the white blood cells that fight infection.
Oh, right.
So leuco, white.
This is fascinating. So erythro,
Refers to
something red, like
What?
erythrocytes for red blood cells. It's like having color-coded clues to decipher these terms.
Exactly.
Okay, now what about prefixes for positions and directions?
So those are like compass points for the body.
Okay.
So for example, epi
Epi,
means above or upon.
above or upon.
Think epigastric,
Epigastric,
referring to the area above the stomach.
above the stomach. Okay.
Then you have peri,
Peri,
meaning around like pericardium,
pericardium,
the sac that surrounds the heart.
surrounds the heart.
Yeah.
So if a patient has an injury below the knee,
Right.
we'd use infrapatellar.
Exact.
Infra meaning below.
Hello.
It's like having a mental map of the body.
That's a great way to think about it.
And we're going to get into even more of those directional terms when we come back
Yes, because this is just
after the break.
the tip of the iceberg.
Right. We've only scratched the surface.
There's so much more to explore.
Stay tuned. Welcome back, listener. We're on this incredible journey through the world of medical terminology, and I gotta say, those abbreviations and symbols, they're like a whole other language within a language.
They can be a bit like deciphering a secret code, can't they?
That's a great way to put it. I mean, that EMT textbook you sent, it's full of them.
Absolutely. But remember, those abbreviations are there for a reason. They're like shortcuts,
Yeah.
especially in emergencies when time is of the essence.
So it's all about efficiency,
Exactly.
like sending a quick text.
Precisely. But here's the thing.
What's that?
In a medical context, clarity is paramount.
Oh, absolutely. You don't want any misunderstandings when it comes to someone's health.
Exactly. Imagine misinterpreting an abbreviation on a patient's chart that could have serious consequences.
That sends shivers down my spine. So how do we make sure we're all speaking the same language when it comes to these abbreviations? The guide mentions initialisms and acronyms. Are those the same thing?
That's a great question. They both involve shortening words, but the key difference is in how we pronounce them.
Okay, so what's the breakdown?
Initialisms, we pronounce each letter individually, like EMT.
Right, EMT. We say each letter, EMT.
Exactly. Each letter gets its moment to shine. Another example is CPR, for cardiopulmonary resuscitation. It's CPR, not sheeper.
Got it. So each letter gets its own spotlight with initialisms. What about acronyms?
Acronyms are where things get a little smoother. We still shorten the words, usually taking the first letter of each, but we pronounce the abbreviation as a single word.
So it's like SAMPLE. It stands for signs and symptoms, allergies, medications, pertinent past history, last oral intake, and events leading to the injury. But we just say SAMPLE as one word.
You got it. It's all about streamlining that communication. And sometimes you even encounter a combination of those abbreviations, like ECAP-BTLS, which represents Emergency Care and Transportation of the Sick and Injured Basic Trauma Life Support.
Wow. Okay, that's a mouthful. So how would you even pronounce that one? ECAP-BTLS.
Not quite. You'd pronounce it as DCAP-BTLs. And then there's USR for Urban Search and Rescue, but we pronounce it as USR. It takes a bit of practice.
It's like a whole new world of linguistic puzzles.
You could say that, but remember, these abbreviations exist to make communication more efficient, especially in those high-pressure medical situations.
Absolutely. But as you said earlier, it's crucial to use them responsibly, right?
Exactly. Always double-check for clarity and make sure you're using those abbreviations that are widely recognized and accepted in your field. The last thing you want is a misunderstanding because of a misused abbreviation.
Safety first. Now, let's shift gears a bit and talk about those positional terms highlighted in the EMT guide. They're not just about anatomy, are they?
You're right. They're also about describing a patient's position, which can be super important in an emergency situation.
So, for example, if you arrive at a scene and find a patient lying face down,
That's the prone position.
prone. It's interesting how some of these terms like prone are used in everyday language, too.
Absolutely. It helps make those connections. Now,
Mhm.
if the patient is lying face up,
Let me guess, that's the supine position.
you got it. Supine for spine. It helps to remember it that way.
Those little memory tricks are lifesavers. Now, what about the Fowler position? I've heard that term used in a hospital setting, but I'm not quite sure what it refers to.
The Fowler position is named after a surgeon, Dr. George R. Fowler, who discovered that a semi-reclining position with the head elevated could significantly help patients breathe easier.
So it's all about patient comfort and care.
Exactly. And within the Fowler position, you have variations like semi-Fowler, where the stretcher's back is at a 45-degree angle, and high Fowler, where the patient is sitting upright at a 90-degree angle. Each position has a specific purpose in patient care.
It's amazing how something as simple as a change in position can make a world of difference.
It really can. And knowing those specific terms allows healthcare providers to communicate those positions accurately and efficiently. It's like having a shared language that everyone understands.
Absolutely. It's all about clear communication, especially when it comes to those critical situations. We've covered a lot of ground here, but I have a feeling our exploration of medical terminology isn't over yet, is it?
You're right, there's always more to learn.
And we're excited to keep diving in. Stay tuned as we uncover even more fascinating aspects of medical terminology after the break. And we're back, listener, for the final stretch of our medical terminology deep dive.
It's amazing how far we've come
I know, right?
from those basic building blocks to
Yeah.
really specific terms.
I feel like we've covered so much.
I have.
Like, I almost feel like I could...
You're well on your way to becoming fluent
Yeah.
in medical terminology.
Before we get ahead of ourselves,
Right.
maybe we should just take a second
Yeah, a little recap never hurts.
to review.
Make sure we're all on the same page.
Yeah, just to make sure we've got all those essentials down. Remember those master tables at the end of the EMT textbook chapter?
They're like gold.
They are.
Yeah. They're so helpful.
So helpful.
They've got everything.
They list all those
Word roots.
word roots, combining
Those,
forms.
prefixes,
Suffixes.
suffixes.
It's like having a little cheat sheet for the human body.
Exactly.
Okay, and speaking of cheat sheets,
Yes.
we talked about abbreviations and symbols.
Right. They're everywhere.
They are. They're everywhere you look in medicine.
In medical world.
And for good reason.
They're important.
They're super important.
But
And
you gotta be careful.
you have to use them responsibly.
Right.
Always double check.
Like really make sure.
Make sure you're using the right one.
Yeah.
Make sure everyone understands.
Because the last thing you want is a misunderstanding, especially when it comes to someone's health.
those do not use lists that the guide mentioned from the Joint Commission and the Institute for Safe Medication Practices. Those are so helpful.
Those are really important.
It's like having those warning signs on a hiking trail.
Right.
Caution. Steep cliff ahead.
Exactly.
Just a little heads up to prevent any accidents.
Better safe than sorry.
Exactly. So we've explored all these fascinating aspects of medical terminology.
It's been quite a journey.
We've decoded those complex terms, we've talked about those tricky abbreviations, and we've even mapped out the human body using those directional terms.
I've really delved deep.
But most importantly,
Yes,
we want you, listener, to feel empowered
absolutely. We want you to feel confident
to navigate.
to navigate the world of healthcare with knowledge and with confidence.
Because knowledge is power.
Knowledge is power, especially when it comes to understanding the language of medicine.
It's like having a superpower.
It is. It's like having a secret key that unlocks a whole new level of understanding.
And listener, our time here might be coming to a close, but
But the journey doesn't end here.
your exploration of medical terminology.
It's a lifelong journey.
Keep those master tables handy.
Consult those reputable resources.
Don't be afraid to ask questions.
Never stop learning.
The world of medical terminology.
It's vast and it's always evolving.
It's fascinating.
And the more you learn,
The more you'll discover.
the more you'll be amazed by
The intricacies of the human body.
the intricacies of the human body.
So until next time, keep those brains engaged.